So, you've recently been diagnosed with gastritis. It can feel a little confusing, maybe even a bit overwhelming, but you're in exactly the right place. We're going to break down what's happening inside your body, nice and simple, and lay out the steps you can take to start feeling a whole lot better.
Does that sound familiar? That burning, kind of gnawing pain right in your upper stomach? It's probably the #1 reason you're here. It's the most common sign of gastritis, and believe me, you are not alone in feeling this.
You know, the first step to feeling better is just understanding. Getting a clear picture of what's going on inside you is so empowering. So let's start right there. Let's figure out what gastritis actually is. To really get what gastritis is, I want you to picture something. Think of your stomach as having its own protective shield, like a suit of armor for its lining. This one idea, this shield, is going to make everything else we talk about click into place.
See, at its core, gastritis is really just a fancy word for inflammation. That protective shield we just talked about, your stomach lining, has gotten irritated, a little roughed up, and weakened. And it's that inflammation that leaves your stomach feeling so raw and unprotected.
So when that shield is down, your body lets you know, right? It sends up flares. That burning pain is the big one, but you might also feel nauseous, bloated, or just not hungry at all. These are all alarm bells telling you that your stomach's defenses are weakened.
Okay, so if the shield is weakened, that means something's been attacking it. So the next logical question is, what? What are these attackers? Let's dive in and identify the usual suspects.
All right, attacker #1. It's a bacteria called Helicobacter pylori. Most people just call it H. pylori. Think of it like an unwanted guest that shows up and just starts chipping away at your stomach's protective shield. It's a super common cause, which is why your doctor will almost always test for it. Now, the next attacker could be in your medicine cabinet. I'm talking about NSAIDs. That stands for non-steroidal anti-inflammatory drugs. Things like ibuprofen. They're great for pain, but they can also block the stuff your body naturally uses to protect your stomach lining. Use them a lot, and you're basically weakening your own shield from the inside.
So you can see we're dealing with two totally different kinds of attackers here. H. pylori is a living, breathing infection. You have to get rid of it completely with medication. But NSAIDs, that's an outside irritant. The game plan there is different. You just have to remove the irritant, stop taking the pills, so the shield can heal itself. Now, besides those two big ones, there are other things that can lower your shield's defenses. Stuff like alcohol, smoking, even a lot of stress. They don't always cause gastritis all by themselves, but boy, do they make it easier for damage to happen and a lot harder for your body to heal.
All right, enough about the problem. Let's talk about the solution. This is the most important part, your action plan for healing. Let's get into how you can actually start rebuilding and strengthening that shield.
It really boils down to a three-pronged approach that all works together. First, we've got to change up the diet to be gentler on your stomach. Second, we have to get rid of the irritants causing the damage. And third, we use medication to help the healing process along. Let's take a look at each one.
Okay, diet. The main goal here is super simple. Just give your stomach a break. Think about it. Spicy, fatty, or really acidic foods are like pouring salt on a wound. They just add to the irritation. If you can switch to blander foods and try eating smaller meals more often, you're creating this calm, peaceful environment where your shield can finally start to repair itself.
And then there's medication. Your doctor's got a few tools in their toolkit. There are acid suppressors, which basically turn down the acid in your stomach, giving that lining a chance to heal. Then there are cytoprotective agents, which are kind of like a liquid bandage. They form a coating over the sore spots. And of course, if H. pylori is the bad guy, there's a special cocktail of drugs designed to kick it out for good.
And listen, I really need to drive this next point home because it's so important. If H. pylori is what's causing your gastritis, you absolutely have to finish the entire prescription your doctor gives you. I know it's tempting to stop when you start feeling better, but if you don't wipe out that infection completely, it can lead to much bigger problems, like ulcers.
So, you're on the plan, you're starting to heal. What happens next? In this last part, let's talk about what to expect on your road to recovery. And critically, we'll cover the warning signs that mean you need to get help fast.
First things first, remember, healing is a process. It takes time. Your doctor will probably want to see you again in about 4 to 6 weeks, just to see how you're doing. And if you were treated for H. pylori, you'll need a follow-up test to make absolutely sure that unwanted guest has been permanently evicted.
Now, this next part is vital. While most people heal up just fine, you need to know the red flags. There are a few symptoms that could signal something more serious is going on, and they mean you need to get medical help right away.
Please pay close attention to these. If you're vomiting blood or something that looks like coffee grounds, if your stool is black and tarry, or if you get a sudden, really severe pain in your abdomen, that is a medical emergency. It could be a sign of bleeding, so don't wait. Get help immediately.
So let's bring this all home. The main thing to remember is that gastritis is totally manageable. Healing is a journey, it's not a race. But with the right care, adjusting your diet, ditching the irritants, and taking your medication, that protective shield in your stomach can absolutely be rebuilt.
So I'll leave you with this question. What's one small, simple choice you can make today to start helping that shield? Maybe it's just swapping out one food item, or maybe it's setting alarms so you don't forget your medicine. Every single one of those little steps is a step toward feeling better.